Hello, I'm Brenda Schivito, and welcome to You Are Not Alone, the place for news, tips, and stories of hope for people battling the disease of addiction. In this two-part series, we will be taking a close look at addiction as a brain disease, the stigma it carries, and how COVID have impacted those struggling to get sober and stay sober. Folks, unfortunately, numbers don't lie. In 2020, we lost 93,331 Americans to substance use disorder. To get an idea of what this number looks like, just envision Beaver Stadium at Penn State University, close to full capacity. Now, compare that number to the 70,630 lives lost in 2019. That's an increase of 25% overdose deaths in 1 year. These numbers are alarming. Today, I'm humbled and honored to have with us Dr. Elyse Rubenstein. Her credentials are impressive, to say the least. But today, I will give you a brief overview of her background and career in psychiatry, which began in 1988. At that time, she started providing psychiatric services at her private practice and continues to do so today. Since July of 2018, she has been the medical director at Mirmont Treatment Center in Media, which is part of the mainline healthcare system. Dr. Rubenstein is board certified in psychiatry, neurology. She has held numerous positions, including psychiatric director, program psychiatrist, and has done psychiatric consulting at a variety of area facilities. She has also participated in numerous speaking engagements, focusing on psychiatric disorders to both physicians and lay people. She is a member of the Academy of Addiction Psychiatry and the American Society of Addiction Medicine. She is a graduate of the University of Pennsylvania and Rutgers Medical School. She completed her medical internship at Presbyterian Hospital in Philadelphia and her psychiatric residency at the Hospital of the University of Pennsylvania. I could go on and on with her impressive bio, but instead it is my utmost pleasure to introduce Dr. Elyse Rubenstein. I cannot be more thrilled to have you here with us today, and just thank you so deeply for all the work that you have done in this area.
Thank you, Brenda. A pleasure to be here.
It's really great to see you. Why don't we start? I'd like to maybe expand a little bit on your background. You've had quite a career in psychiatry. Kind of like give us a little flavor of where you've been and what brought you into the area of addiction.
I'm on my 34th year of practicing psychiatry, and I've worked in pretty much many areas, many levels of care of psychiatry. I would say it's been probably close to 30 years now, so pretty early in my career that I began affiliating with different drug and alcohol treatment programs, outpatient, inpatient, mother and baby units, until I landed at Mirmont. This is my 7th year at Mirmont Treatment Center.
Okay, great, great. That's a fabulous location, and it's a great place to be for those who are battling addiction and trying really hard to get into recovery. I've heard really great things about Mirmont.
Absolutely. I can only say really wonderful things, truthfully, about Mirmont, and I've worked, as I've alluded to, in a number of places, and I really feel like I've found a place that I can feel really comfortable at and feel really proud of working for. We are a facility filled with staff that are really interested in doing the work they're doing, really invested in the work, really invested in the patients, and also a program that really tends to individualize care of these patients who are very different, have similar but differing stories, different medical needs, needs, different psychiatric needs, and we really try to tailor our program to the individual patient.
That's great. Because to your point, yes, every case is totally different, individual. There's not one size fits all when it comes to the disease of addiction.
Absolutely.
So let's talk about the actual disease of addiction. It's come a long way in being recognized. So can you give us a little bit of background about how it came to be now, called a disease? Because it wasn't always, I don't think. Help me.
No, I think the science has really progressed in terms of understanding the brain changes that occur in disease, the way the brain can look and how long it can take to heal in various addiction disease states. And really just, it has come to be framed as more of a chronic disease than a set of behaviors that people need to be either punished for or somehow censored for, as opposed to treated for as we would for any other medical disease like asthma, COPD, diabetes, and other blood sugar, blood pressure. It's along the same lines. And the evidence for that is that we see how these brains are affected and how sometimes they take the better part of a couple years to actually heal and normalize.
Right.
But I think, I think the professional community is coming around, but I think we still have a ways to go in really recognizing that people are not in the place of needing help for addiction because they want to be. They are struggling, they are suffering, and they are not able to do it themselves. Just like people with medical conditions need medical help, they need medications, they need maintenance, they need follow-up, they need ongoing treatment. It's the same for the disease of addiction.
Right, exactly. And you mentioned that it's a chronic disease. So maybe you could expand on that a little bit for people who may not understand addiction as chronic.
Absolutely, and I think that's important because I think I've heard, even recently, within the past week, people saying, oh, but they didn't get cured the last time that they went to treatment. They weren't cured. So why bother trying again? I mean, this is a disease that can require multiple attempts at treatment. And even when the treatment is successful, meaning that the person has a certain amount of clean time, whether that's months or that's years, this disease may recur and may require a tune-up, let's say. So it's not something to look at. Can we cure it? Is the person cured for life? This is something just like any other disease that they need to keep on top of it. They realize that stress is probably going to exacerbate it and create a flare-up potentially. Losses, other stresses, medical illness, so many things, relationship strife, can all exacerbate and cause these illnesses to recur. So there's no cure. There's only good treatment and acute treatment and maintenance treatment for these illnesses.
So what would acute treatment involve? What would that look like, acute treatment?
So acute treatment is someone who realizes that this disease is out of control in the sense of affecting multiple spheres of their life, relationships, occupational, legal spheres of life, and realizing that they need a kind of an intensive acute treatment now, sooner rather than later. And that may involve going into an inpatient facility, like I am involved with at Mirmont Treatment Center, or a more intensive outpatient treatment center situation, which Mirmont also offers under Mainline Health. So we have all levels of care depending on whether the person needs detox, how unmanageable their disease is, what kind of supports they have, what kind of housing they have or don't have. So there are a lot of factors, but the important thing I think is to reach out and express, to acknowledge that one needs help, make that initial contact, and then all the help in the world will be there as far as deciding where should they go, what should their next step be.
Right.
The important thing is that help is out there. One just has to reach out for it.
Absolutely. And that sometimes is difficult for somebody to, to come to terms with their addiction and to acknowledge it. And so many times, so many people stay in denial state.
Right, and I think that kind of leads us to the whole stigma issue too. I think a whole lot of people will say to me that they tried so long to do it on their own. They tried and tried to do this at home, to do this on their own, and it just wasn't working. And I think part of it is feeling like they should be able to do this on their own, like this is all under their control. And that's what I alluded to before when I said that people don't want to be in these situations. No. And they tend to blame themselves. They tend to point the finger at themselves as having responsibility for just the fallout of the addiction in terms of their families and their jobs and their kids. And that I think is a real thing that we all have to work on is in terms of the medical profession in general, psychiatry in particular, and just society at large, to realize that these people are suffering, they're hurting, they're not choosing to be in this situation. They can't just will it away. It's not a matter of just willpower, working harder, doing better. This is a disease that can get very out of control and that people require medical, psychological help for in terms of recovering.
Absolutely. Because I think it's also a slippery slope, and it's such a fine line because of the legality of alcohol and now coming into more legal permission with marijuana. So I think that, we have these mixed messages of, these legal substances that are being abused. And so many people I know, even my own circle of people I know, it's like alcohol, it's everywhere. Yes, it's part of our society. It's part of our rituals. It's part of our gatherings with family and friends and birthday parties and these events. And I think that's it's a very difficult place for people who are struggling.
Absolutely. I think that's important to note that actually more people have died of alcohol last year than even the opiate epidemic, which is clearly doing, a serious problem ongoing as well. Right. But yes, alcohol is, probably 12 to 13% of our population is actually suffering from alcoholism. I don't think people even realize what qualifies as alcoholic drinking. I mean, it's become so much the norm, especially with people working at home and the isolation COVID. And the stress of that. Right. But yes, alcoholism is absolutely out of control, and it is a disease that affects really every organ system of the body, as well as all of the psychosocial implications you would think about as far as, again, their jobs and their families and just the medical fallout. So that's another serious disease, yes, with a substance that is legal. And the marijuana thing, I deal with every day. It's something that the legalization has kind of made people think that this is, this is like any over-the-counter drug, just it's innocuous, it's safe. It helps whatever ails you, one. Sure. And the truth is that there's really only very few things that marijuana has been proven to be helpful with in terms of an evidence-based way of looking at it. And so it's really overused, particularly by our addiction patients who don't realize that they can't necessarily say, I'm going to keep doing my marijuana, but I'm going to really try to give up my cocaine and alcohol. It really doesn't tend to be successful, unfortunately.
So in that response, it's either you're sober or you're not. Like there's no halfway measure, oh, I'm not going to do my, I get what you're saying. It's like, oh, I can handle my beer, but I'm just going to stay from away from hard alcohol.
Right. And I mean, right. And it's not because we're trying to be rigid and just say, sorry guys, you got to wipe out everything and take away all your crutches.
Sure.
But it's because it's been shown that because these are brain diseases, if you pick up one drug of choice, you're very likely going to be led back to the other one. It's really hard to cut off one but leave the other one. So
tell me, if you can expand a little bit, because I have curiosity about this. What is the difference, I guess, in the brain structure? How is it that I have two sons? One became addicted, as you know, and we lost him to accidental overdose with fentanyl. And my other son does not have addiction, substance use disorder. So how does it happen that one brain is this way and another, not specifically my children, of course, but I'm just saying, comparing, one person to another. How does it happen?
I mean, it is fascinating. I think it's similar to some other diseases, certainly other mental health conditions. I think, and probably if I had, the answer to that, I would be, a multimillionaire, not sitting here right now, although I enjoy sitting here. But I think that addiction is probably 40 to 60% a genetic disease.
Okay.
So that does leave a lot of room. But I think the important thing is to realize that it's a developmental biopsychosocial disease. Okay. So it is so complex in terms of the factors that go into making it happen. So it's really hard to say why two kids raised in the same environment, sometimes two twins even, there might be one has a certain disease, whether it's whether psychiatric, medical, or addiction, and the other one doesn't get it. Right. And trauma is just a huge contributing factor to addiction. Right. So not everyone perceives, what seems to be sort of like the same environment in the same way. Right. So it's very complex. It's a complex question.
So the individual does not choose addiction. Addiction chooses the individual.
Absolutely.
Because as we know, young people across our country, they experiment, their friends are doing it, they're smoking marijuana, they're having, drinking parties, and a year or so later, or 6 months later, as we know, addiction can happen very, very quickly. Some of these kids are still going about their business, living their life, and some of them have been caught into these struggles. So I think it's really important that our young people really get the message that this can happen to anyone, anytime. And it's not just, even as teenagers and even into adult life, to your point when you spoke about stressors of life and different things that occur, can put anybody at any age, any socioeconomic situation into this disease.
Absolutely. It definitely defies socioeconomic lines and intellectual success. I mean, we see very successful people. We see people, all across the spectrum of race and age and socioeconomic background, and it really transcends all of that. I mean, I think there are certain categories of people who are more disadvantaged, more vulnerable, certain races that have severe access problems as far as treating addiction. Right. But the addiction itself is across the board.
Speaking of access to resources, in your opinion, is 28 days of inpatient enough?
I mean, we even struggle sometimes to get people 28 days, to be honest. But no, it's not. Because like I said, this is a developmental, which means it probably started in childhood. It goes back a long ways, and trying to treat it in 30 days, 28 days is unlikely. And that's why I said in the beginning, this requires a stepwise model of care. So let's say the 28-day inpatient is really, and I say this to patients every day, this is just the beginning. Like, you have just started your treatment now. It's not over. Right. This is the beginning, and it's a great start. Sure. But you need to continue into stepping down into progressively lower levels of care, which include a partial hospital, which is a day treatment program, to an intensive outpatient, which is a few hours, a few days a week, to outpatient, which is like once a week. It's a whole process of treatment that needs to go on for quite a while. So the answer is no, 28 days. Again, there's no cure, and 28 days really just begins to touch, the surface, really.
And unfortunately, it seems that insurance companies dictate this 28 days.
Absolutely.
Or less in some cases.
Absolutely.
People are disadvantaged. Like, to your point, a lot of them, they don't have access to 28 days, no less, like 2 weeks, 10 days, or even a detox. And that's just so unfortunate.
And it's so short-sighted, because this disease is costing society so much more, many more dollars than bringing someone in for a decent, comprehensive, solid treatment experience.
Right. And I have to say, I have read about this opioid addiction and these illicit drugs out there. Fentanyl. Seems everything is laced with fentanyl. It's actually killing a generation of our workforce.
That's right. And that is, in 2021, it's probably one of the scariest times ever, because I look people in the eye every day, and they're kind of surprised when I say, you have no idea what you were actually using. And when I tell them, you weren't actually using heroin, there's no evidence of heroin, you were actually using fentanyl, they're like, really? I did not know that. I would say it's the minority of patients that even realize what they are using. And it's not just with heroin being contaminated, it's you name the street drug, it is contaminated with fentanyl.
So tell me about heroin versus fentanyl. What's this misnomer? Like you're saying, people don't get that, or they open their eyes and they don't understand. Let us know, what is the difference between heroin and fentanyl? What's the difference?
It's the potency. So, you're talking about, if we had a picture of it, a little pile of heroin would equal like a dot of fentanyl. So the potency is anywhere between 50 to 100 times different. And there are many other offshoots, manufactured forms of fentanyl that are even more powerful than fentanyl. Correct. And so it's the potency, it's the tendency to kill people, it's the fact that it doesn't respond as easily to the Narcan that we have out there. It stays in one system a little bit longer than heroin, so the detoxes from fentanyl are a little more tricky. And that's why I say that we really try to individualize everything at Mirmont, so people are getting detox when they should, but not too soon. There's something called precipitated withdrawal, where if we treat too soon, they go into basically an industrial strength withdrawal that's worse than the withdrawal they would just go through on their own. So it's a very tricky business in terms of just killing people and also treating them, but nonetheless, it is treatable, and we are all talking about the best ways to treat it, how to detox, when to detox, and there's hope and there's ways to deal with it. But I just think people need to realize that they are playing with fire on the street right now.
And so a detox is typically how long of a time would a detox be? And is it something that people do on their own outside of a treatment facility?
They try to. It depends what the substances are. There are several substances out there that do not require a medical detox. Probably the most prevalent one on the street right now that would fall into that category is meth. There's definitely a surge in meth, which is also extremely dangerous, often mixed with heroin and fentanyl, actually. So a detox from opiates, again, we do it extremely individualized. I say the average is 5 to 7 days, but it depends what people have been using and for how long, because sometimes they can't even start for a couple of days. So it's a process from alcohol, a little bit longer, alcohol and benzodiazepines like Xanax, which is ubiquitous on the street, Xannies, also very dangerous, mixed with fentanyl, even in a pill form. There's something called press pills. So even things that actually look like a manufactured prescribed pill They're called pressed pills, and they are manufactured to look like Percocet, look like Xanax, and they are actually, if not all fentanyl, significantly fentanyl.
Unbelievable.
Yeah.
It's just unbelievable. So it's interesting when you said about alcohol a little bit longer. I wonder if that's why during COVID they didn't close state stores. Were they afraid? I mean, I'm just saying, your opinion. Do you think they were afraid of people not having alcohol and perhaps dying because of withdrawals from it?
Absolutely. I mean, I think, yeah, I definitely think so. I mean, I'm sure there are probably less altruistic reason for alcohol stores thriving during COVID, but absolutely, it would have been dangerous to suddenly cut off people's supply of alcohol. There's no doubt about that.
Of a legal substance.
Right.
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 So
and then also a dangerous substance to stop.
Right.
Cold turkey.
Absolutely.
Yeah.
Absolutely. Well, I guess in some respects, that was a good thing.
Right.
In some respects,
yes, it was a good thing.
You mentioned, blame and shame and punishment, a lot of these negative terms associated with addiction. So I know when we talked earlier, you mentioned something that, relapse is viewed as bad behavior. Maybe expand on that a little bit. What's going on with that? A relapse is part of the disease.
Right. So these are relapsing diseases. They are absolutely relapsing diseases. And that goes along with there's no cure for them. They are relapsing. And so people feel incredible guilt, self-defeat, about relapsing. It's really the same as having the disease and then having it flare up again.
Right.
But like diabetes, sometimes people's blood sugar gets really high and they have to go to the hospital.
Right.
It's the same thing. So we need to start kind of bringing all these diseases together in people's minds so there isn't so much self-flagellation and shame associated with their disease flaring up again.
Right. And again, I think that's a lot of awareness and what we're doing here, and just bringing awareness to this brain disease and helping people to understand that it
Absolutely.
Is a brain disease. Well, our time has gone so quickly, and I couldn't be more engaged with this and talking with you. And I'm really looking forward to the part 2 of this series, because I think your information is so valuable, and it's been so wonderful for you to be here sharing this.
Thank you very much, Brenda. A pleasure is mine. I really like to spread the word, so happy to do it.
I look forward to that. And if people need to get a hold of you, can they get a hold of you or get a hold of Mirmont? How would they get in contact if they wanted more information?
Absolutely. So Mirmont Treatment Center they can call 484-227 1453. That is Mirmont Treatment Center itself. And that would be a referral line for whatever level of care they might need in some direction, including inpatient care. And then my direct line at Mirmont Treatment Center is 484-227-1472. And I do have a private practice which deals with really everything in behavioral health. And that is 610-254-8515.
Thank you again so much. We really appreciate you being here. As we close out part 1 of this 2-part series, we hope this has given you a clear understanding and/or a new perspective on the disease of addiction. Please join us next time as we continue to explore more facets of this complex disease. If you or a loved one needs help or would like to donate, please visit us anytime at angelsagainstaddiction.org. I believe that together we can help save lives. Thank you.